Hello friends, now we will see the antidiuretic agents. The learning outcomes for this chapter will be upon completion of these sessions, the learners will be able to classify the drugs which are used as an antidiuretic agent, explain the mechanism of action for the drugs which are used as antidiuretic agents, as well as they can predict the clinical application of antidiuretic agents. Now, the antidiuretic agents are classified as an hormones, that is ADH and vasopressin. Synonymously they are called as, and their synthetic analogs like desmopressin. Next is the thiazide kind of drug, amyloid, and other drugs which are not from the specific category. By miscellaneous mechanisms they are working as an antidiuretic like indomethacin, chlorpromazine, or carbamazepines. Very first agent we will see the antidiuretic agent, as an ADH. It is also called as a vasopressin. It is one of the hormone which is secreted by the posterior pituitary gland. It specifically works through the two receptor V1 and V2 receptor. V1 receptor action is a powerful vasoconstrictor action. It contracts the smooth muscle. Whereas whenever the ADH or vasopressin, when it elicits its action by the V2 receptor, it increases the water reabsorption. The water permeability for the of the membrane for the water is increased. Now generally what happens is that there is an increase in osmolarity due to decreased blood pressure or hypotension or decrease in the water content of the blood. So this increased osmolarity stimulate the baroreceptor, and this stimulation of a baroreceptor, which is present mainly in the neck region like here, and this baroreceptor will send the signal to the hypothalamus, and in turns the hypothalamus perform two functions. Number one function is that it send a signal to the thirst center, and due to the thirst center water drinking capability or water drinking desire is initiated, where drinking of the water increases the blood volume and reduces the osmolarity. Whereas this hypothalamus also does the second function, that it sends the signal to the pituitary gland for the release of EDH, that is vasopressin. This released vasopressin then do the two functions: water reabsorption by increasing the permeability of the membrane for the water reabsorption, and the vasoconstriction. These two actions it is taking place, and thereby increases the blood volume, and by increasing the blood volume it reduces the osmolarity. The same thing, same mechanism over here I have explained. So here there is a reduced osmolarity or decreased osmotic pressure, and which is that there is a signal to the hypothalamus do the two works. That is, one, first of all it stimulates the pituitary to release the vasopressin, and second it send the signal to the thirst center for the drinking of the water, which increases the blood volume and osmotic pressure. Whereas whenever there is a release of vasopressin, it act on two. One, it produces a vasoconstriction, blood vessels are vasoconstricted, whereas kidney reabsorption of the water is increased. So this is increasing the blood pressure, and there is osmotic pressure, increases blood volume, and osmotic pressure is reduced over here. So these are the actions of ADH hormone. Now as far as the clinical applications of the this ADH is concerned, for the V1 receptor action, the ADH is used for the bleeding esophageal varices, and before the abdominal radiography this ADH is used by virtue of its V1 action, and by virtue of its V2 action ADH is used in the treatment of diabetes insipidus, that is also known as a neurogenic diabetes, diabetic in the children's, renal concentration test, and hemophilia. These are the clinical applications of ADH by the virtue of their V1 and V2 actions. As far as the adverse effects are concerned, by the treatment of ADH, there is a transient headache and flushing response which is obtained. If the ADH is given locally or applied to the nasal mucosa, it produces irritation, congestion, and ulceration. Then systemic side effect includes belching, then nausea, vomiting, abdominal cramps, pallor. Then fluid retention is one of the typical adverse effect of ADH. Bradycardia, increased cardiac afterload, precipitation of angina. This ADH is also contraindicated in the patients with the ischemic heart disease, hypertension, and nephritis. These are the adverse effect of the ADH. Now, the next category of a drug is the thiazides. These are the some derivatives from the diuretics actually. So, few of them diuretics are performing the reverse function over here. The paradoxical effect they are having, short and brisk action they are giving, their duration of action are the short and brisk action. Mechanism is similar to that of salt retention. Sustained release electrolyte depletion it causes and reduces the GFR, reducing the fluid volume. Specifically, these thiazide kind of compounds are used in a lithium-induced nephrogenic diabetes insipidus. And the last category, that is other diuretics, the different kind of other drugs which are specifically used as an antidiuretics by virtue of their other effects, not directly through their diuretic or antidiuretic effect. So first one amongst them is indomethacin. It is NSAID drug. So it is a prostaglandin. It reduces the renal prostaglandin synthesis, and by that way it inhibit the uh, it enhances the water reabsorption process and reduces the polyuria in a neurogenic diabetes insipidus. Generally, they are combined with thiazide diuretics, which in the previous category we have seen. Along with that, indomethacins might be combined. Next is chlorpropamide. It is a long-acting oral hypoglycemic agent, effective in a neurogenic diabetes insipidus. Chlorpromazines are the antiepileptic agents. They are also effective in neurogenic diabetes insipidus, and very high dose of this drug is used as an antidiuretic, and it have a marked adverse effect. Therefore, they are not recommended as such for the antidiuretic actions. So these are all about the antidiuretic drugs. Very limited clinical applications they are having. So if you have any kind of problems, you can contact here me on this phone numbers, or you can write me to this email ID. Thank you very much. Thank you.